If you've got questions, let's take the questions. I think anything I've left out will come up through the questions and answers. Now, let me answer on the exercise and why we have the isometrics in there and not other types of exercise. Although I would agree, and we're putting out a new booklet which is going to include swimming as one of the exercises, because swimming can be a very limbering type of exercise so that all of the muscles are included and you don't have to do it energetically. What we don't want the cancer patient to do is to do jogging and aerobics. In other words, exercises to keep the body limber, the muscles active, but not to the point where you're exhausting the body, because then you're going downhill instead of uphill. You see, you're taking good energy and wasting it. And that's why we've selected the isometrics in the packet.
What is your position on amygdalin or laetrile as adjunctive therapy?
All right. Let's call it Laetrile because it was the trade name for it. Many years ago, when we first started, a lot of people did use Laetrile. It was very beneficial. There's some material in there, the nitrilicides in there, which seem to be beneficial for patients. We don't feel as comfortable with anyone depending upon Laetrile today as we did then. And in those days, very often they gave under 1 gram injection, or let's say a 1 gram injection. Now each vial contains 3 grams. And they're giving as many as 4 vials a day. We're talking about 12 grams of Laetrile. We don't see the same response with that dose as we did with the earlier doses or the patients who had used it then. It became so popular with people promoting it, and the people who were promoting it selling the merchandise. And I don't think realizing that you've got to be somewhat careful with the way you process natural material. It comes from apricot kernels. And they were taking a great deal of pride in the fact that it was being refined 95%. And while they were trying to sell the 95% refined material, we were telling patients try to get the 65% refined. Had to have some refinement, you see. Do you see? If you refine sugar, you're going to take the nutritive value away. And we feel this is what they have done to the Laetrile. We would sooner suggest to patients today that if they want some of those nitrilicides, to get the apricot kernels or other kernels, and it isn't just apricot kernels, rich in the nitrilicides, use those. You know that you're getting the total material and the most potent of it too. All right? Now, I know a couple of people came up to me and told me that they were on Laetrile. If they're doing all right, I would suggest they stay with what they're doing.
Regarding freeze-dried calf cellular cells from Mexico, has Chernobyl had any negative effect on those?
I don't think well, Chernobyl was in Russia. I don't know whether it has had any effect. We have no sign that it has hurt the cells. People have been getting them and they've been saying they feel the improvement from it. So we have no evidence that it has hurt the cells. I wouldn't want to be the one to guarantee anything when you're using atomic bombs, you know, or an atomic accident of that kind. I think we ought to fight that in another way. Thank you.
Ruth, I'd like to hear your comments about the attitudinal healing meditation.
Yes.
Subliminals.
Well, I don't have enough experience with subliminals, but you'll notice that we do have a psychoanalyst on the program for today, actually, because we know that attitude plays an enormous part in healing. If everyone in this room was put on a perfect diet by the perfect doctor, just right for their body chemistry and taking everything that they required into account, and your body was under stress at all times, it would upset the metabolism of that good material. Nothing would function properly. I want to give you one of the best examples of taking stress or attitude into account. Dr. Hans Selye, who was diagnosed as a cancer patient with a very severe kind of cancer that meant he had a very short period of time to live. We're talking possibly in the months. All right? Now, he died recently, and I don't know that he died of cancer at all. But what he did was to begin to take the stress out of his diet. He knew stress out of his life. Knew nothing about diet, by the way. All he did was reduce stress, and he began to do research. He was up in Montreal and wrote a book, Stress and Distress. He died 10 years after the diagnosis, just because he had taken stress out of his life. And his research pointed out to him that what stress does is it plays havoc with the endocrine system. And the secretions of the endocrine system is what are required by the body for it to sustain its health and regain its health. So I hope that shows you how important attitude can be.
If I could just follow
I'm going to, yes, go ahead, follow up. I'm going to tell you a little bit more about that.
Okay, this is my first meeting, so you probably have talked about this at length in the past, but could you comment about the vitamin C therapy?
Oh, very good. I'm glad you asked the question because I should have taken it up. Of course, it's been promoted by Dr. Linus Pauling, who's a biochemist. Now, it does not fit in with our concept of how a cancer patient ought to be treated. One speaker from our platform and a good practitioner who most of his patients are cancer patients and he's getting good results. He said those high doses of vitamin C over a long period of time will burn up your own enzymes. In other words, your own body will have no ability to metabolize the vitamin C. You're overdoing it. Our bodies require vitamin C, but it requires it in normal amounts. If we're trying to normalize, you don't even have to take supplementary vitamin C necessarily. You've got vitamin C in many of your food supplies, and this idea is that your body can't deal with it as animals deal with it is a fallacy, because if that was an accuracy, many of us would be gone because we're not taking vitamin C. I don't take it. Do you see? How would we survive if our bodies weren't handling it? Now, Linus Pauling's wife died of breast cancer while he's been promoting these huge doses of vitamin C. I don't like to be critical of an individual, but I feel I have an obligation to bring you the information. We are adamantly opposed to fluoridation of the water supply. A biochemist as qualified as Dr. Pauling has done a very serious study of the link between fluoridation and cancer. And he has shown that in communities that have been fluoridated compared to communities unfluoridated, there's been a 10% rise in the incidence of cancer. So we're opposed to fluoridation. Linus Pauling supports it. Here is a biochemist who supports using a material that we know scientifically interferes with enzymatic function. We know scientifically that it interferes with what they call bonding and many other things. We're talking about scientists who have come to these conclusions. We don't have anyone talking about fluoridation this year, but we have had people in previous years who have given the audience the scientific data on fluorides. And here we have what we would consider two contradictions in what he is supporting. So I'm not even going to say whether I feel he's right or wrong. We don't support his work, and I've given you the reasons why.
What has your experience been with live cell therapy as practiced by American Biologics in Mexico?
It would be the same as any experience, even in Switzerland, with the live cell therapy. And I told you how I felt about it. The doctor down Dr. Kuno, I believe, is doing the live cell therapy, and it's good quality. They don't have their sheep available there. They're getting it they're actually getting live cells frozen. In other words, it's the whole cell, but it comes to them in a frozen container and shipped from Europe to them. This is my understanding of all the people outside of Europe who are using live cells. But it's fine.
Have you heard about Dr. Sharma in England and his Iscador therapy? And if so, what do you think about it?
Dr. Sharma, they're using the Iscador at the Arlesheim Clinic in Switzerland. Is he there? Do you know the clinic? You're not talking about Dr. Scharf, are you?
No.
Scharf?
No.
All right. Iscador, which is really something derived from mistletoe, is used as a homeopathic preparation. There are some doctors in the United States who are using mistletoe because it's a homeopathic remedy. There's a clinic in Sweden, it's called the Arlesheim Clinic because it's in Arlesheim, Switzerland, where they do the Iscador treatment there. They have incorporated a dietary program, probably not the most ideal dietary program. Some of it was developed by one of the doctors we've had on our platform, Dr. Ali. I don't know to how many, we've had him frequently. He comes in from Sweden. And they also, if they have to do surgical procedures there and they feel the surgical procedure is useful and maybe going to be more beneficial for the patient than going without the surgical procedure, and they're very modest in the way they handle it, and this is what we like about it.
As far as Iscador is concerned,
It's a good natural therapy. It's a biologically sound material.
On this, but what is your view of the Gerson therapy?
We think Dr. Max Gerson did an excellent job. That he was one of the early pioneers in this field, although there were people before him that some people don't realize, that he was picking up information too to go in this direction. As a matter of fact, he started originally in Europe before he came to the United States. That program is run by his daughter. The Gerson Center is run by his daughter. She is limited to the book, which was published in 1954, I believe, about 5 years before Max Gerson's death. He died in 1959. Now, we prefer resources that have added on to what was begun by Dr. Gerson. If you come back from the Gerson Center, that's a good clinic system. 3-4 weeks down there, and they give you all the material that you need. Someone gets it ready for you, fine. A patient coming home is going to need help. You can't do that program. You're lucky if you can get along between the cancer patient and another person. You might need 2 people to help. It's a very rigid, strenuous program. And another problem that exists with that program is you've got to have liver juice on the program. It is part of the components there. It's part of the protein. It's part of liver restoration. So you need the liver juice. And our experience with trying to find resources for good quality organic calf's liver, unfrozen, which is what you ought to have, is practically nil.
I was wondering if there have been any therapies for brain cancer patients that are not toxic.
Anything that is right for the breast cancer patient, because it's dealing with body chemistry. Now, there's one system with many differences in it, and that is you treat the host of the cancer, you deal with his body chemistry and his differences. But where the tumor is located isn't necessarily the criterion of how the program will go.
My question is, what would be the first step in determining whether cellular therapy would benefit a breast cancer patient? And is there a test that you can tell what organ would be?
Yes, they do. Yes, they do a test to find out which organ ought to get the cells.
Even if it's just a breast cancer?
It has nothing to do with the breast. It's not a cancer therapy. It's not a breast cancer therapy. It is a therapy to start your body to do the healing. In other words, they don't give breast cells. What they will give are cells based on your biological weaknesses. In other words, if you've got a weak liver, they'll give...
How do they determine that?
They do their own diagnostic work. Okay? In Europe, they used to use a test called the Abderhalden test, but I don't know whether that's... Kay, she left the... Oh, Kay left. She has had cellular therapy. I wanted to ask her if she knew what Dr. Estrella had done. But it's all right. Go ahead.
Are there any tests to determine whether or not your body is digesting a tumor? How do you know if you're winning the
Digesting a tumor?
Or what are you...
All right, let's take the question as it stands. Now, this is a test which is not accepted by the medical community here in the United States. We would hope one day they would look into it more carefully and give it greater consideration, by the way. It is called a chorionic gonadotrophin test.
Could you spell it?
Don't take it down. I'll simplify it for you. It's HCG. You go to your doctor and ask him to do the chorionic gonadotrophin test for cancer, and he'll say you're crazy. So let me first explain something. It's called an HCG test, by the way, but it can be done two ways. It is done what they call a qualitative report or a quantitative report. They use quantitative reports to determine whether a person is pregnant or not. A qualitative report. A quantitative report, I'm getting a little mixed up. The quantitative report is a test which is done by a specific doctor, a Dr. Navarro in the Philippines, and it has to go out of the country. And let me tell you why this test has value. When the body is producing cells above the normal rate for cell reproduction, it secretes this particular hormone in the urine. Now, a Dr. Howard Beard developed this test as a cancer test, a biochemist from Fort Worth, and he was a cancer victim himself, and he used this test to see what progress he was making. Since then, other people have picked it up. Now, if you're not pregnant and you get a high reading, you have to realize the body is producing cells abnormally. If you're something else I want. Mostly if you're not pregnant, you get the high reading. If you're a male and you get a high reading, you realize the body is producing cells abnormally because the male isn't going to be pregnant. If you're over 65, people of that kind, but you get the general picture of what I'm trying to paint here. So they use this test to see if there's normal cell production or if it's way beyond that normal cell production. Now, if you want to use it yourself, you have every right to use the test. You collect your own urine sample. You send it out of the country. You can't use laboratories in the United States because you have to go through your doctor. We've tried to get laboratories in the United States, even going through the doctor, and they don't do the test. They haven't got the equipment to do it. They haven't been set up to do it. They know how and can do it, but they haven't set up for it, and we've tried it periodically over the years we've been here. But that's one way where you can tell whether, now it's not going to tell you whether the breast tumor is going down, listen carefully, but it can tell you long in advance that your body has made the correction, that it is no longer producing additional cancer cells, even though the tumor might be there. It might get to the point where the tumor will begin to go down. It can also tell you in advance that maybe a tumor can be developing. In other words, that the body is now out of order and is overproducing cells. HCG, I will tell you something additional that we learned long after Dr. Navarro, Dr. Beard developed the test and Dr. Navarro started to do it. And it was simply this. We found a group of researchers who had done some work in England, and it was published in Nature's magazine, which is a very a periodical that is readily available, where they tried to determine why a fetus wasn't rejected because it's foreign to the body, all right? And what they found was that when a fetus is developing, the titer, what they call it, the titer, or the numbers, when I'm talking about, I want to try to help you to understand everything I'm talking about without using technical terms, but it's called the titer. When the reading goes up in the HCG secretion, immunity goes down. So we know we can relate it to whether there's good immune activity or not. The immunity goes down during the time the fetus is developing so that the body will not reject the fetus. And as soon as the immunity goes down, birth is ready. Can you see the connection? I hope you can. It's a little complicated. Huh? When the reading goes up, the immune system is depressed. When the reading goes down, the immune system is enhanced. And at that point, the fetus is produced, your birth takes place. Who's what?
Just related to the HCG, do they need to have a previous reading to know whether or not it's improving?
Well, yes. You have to use one reading as a yardstick. But even the first reading will tell you whether the body is in an abnormal state or a normal state. But from then on, you keep getting readings and you can monitor the situation with it.